Excellencies, Heads of State and Government, Chairperson of the African Union Commission, development partners, ladies and gentlemen, on behalf of His Excellency President Paul Kagame, I'm honored to join you at this critical high-level meeting on our coordinated response to the ongoing Ebola outbreak. We convene at a moment that demands both urgency and unity of purpose. Rwanda expresses its solidarity with the countries and communities currently affected by Ebola. We also pay tribute to the frontline health workers and responders who continue to serve with courage and dedication under very difficult circumstances. Excellencies, the Ebola outbreak reminds us that health emergencies do not respect borders. Our response, therefore, cannot be fragmented, delayed, or reactive. No country can stand alone in the face of infectious diseases threats, and our collective safety depends on coordination, timely information sharing, and regional solidarity. I'm happy to emphasize that Rwanda is currently Ebola-free. And this is the result of deliberate investments in preparedness and resilient public health systems. Since the outbreak was declared in the region, we have intensified surveillance at all points of entry. We strengthened screening and laboratory capacity, pre-positioned essential medical supplies, we trained health personnel, reinforced emergency response mechanisms, and we maintained public awareness campaigns. We have also worked closely with the neighboring countries and regional institutions to strengthen coordination, prevent cross-border transmission, and ensure the safe movement of people and goods. We remain committed to deepening this cooperation because the security of one nation is inseparable from the security of all. So I want to take this opportunity to commend the positive trend in regional health outcomes despite the epicenter still being active. Most notably, we understand that Goma and Bukavu have no active cases today, and Uganda has not seen any new cases in the past week. This is clear evidence that by working together, we can put an end to this outbreak. Excellencies, as we work to bring this outbreak to an end, we must recognize that Ebola is not the first public health emergency our continent has faced, and it will not be the last. In recent years, Africa has confronted Ebola, COVID-19, Mpox, and other health crises in rapid succession. The question before us today is whether we remain trapped in cycles of emergency responses or whether we build the systems and capabilities that make us truly resilient. So under the leadership of the African Union, we must take greater ownership of Africa's health security, and we must resist our continued dependency on external responses to challenges we can increasingly address ourselves. This requires sustained investment in surveillance systems, laboratory networks, health infrastructure, research institutions, and above all, our people. We remain grateful to our international partners for their continued support. Their contributions have saved lives and strengthened our collective response. However, we consider that the long-term resilience of Africa's health systems must ultimately be built by Africans for Africans. Rwanda stands ready, prepared, vigilant, and committed to working with the countries across our region, the African Union, and our international partners to build a safer, healthier, and more resilient Africa. I thank you.